Welcome to Dr. Mai, sharing medical knowledge. Today's topic is coronary artery disease. Don't forget to subscribe, like, and comment below to support our channel's development and receive more informative content. What is coronary artery disease? Coronary artery disease is a type of heart disease that affects the arteries responsible for supplying oxygen-rich blood to the heart muscle. This condition occurs when fatty deposits called plaque accumulate within the arteries, a process known as atherosclerosis. Over time, these plaques can narrow or block the arteries, impeding blood flow to the heart and leading to serious health issues. The impact of coronary artery disease. Coronary artery disease is a leading cause of mortality worldwide, posing a significant threat to heart health. According to the Centers for Disease Control and Prevention, coronary artery disease contributes to approximately 400,000 deaths annually in the United States alone. Alarmingly, 20% of these deaths occur in individuals under the age of 65, highlighting the critical need for awareness and preventive measures. Understanding atherosclerosis. Atherosclerosis is the underlying cause of coronary artery disease. It involves the gradual buildup of plaque within the arterial walls. Plaque is composed of cholesterol, fatty substances, cellular waste products, calcium, and fibrin. The accumulation of plaque leads to the thickening and hardening of the arteries, a condition that can significantly reduce or block blood flow. Comparing arteries to a clogged drainpipe, Dr. Juan Carlos Rozo, a cardiologist at Houston Methodist, provides a vivid analogy to help us understand plaque buildup. He compares it to a clogging drainpipe. Just as a slow-draining sink needs to be fixed to restore proper water flow, clogged arteries must be addressed to ensure adequate blood flow to the heart muscle. Left unchecked, these plaque deposits lead to the narrowing and hardening of the arteries, impairing blood flow to the heart muscle and potentially resulting in severe and life-threatening complications, explains Dr. Rozo. Recognizing the symptoms of coronary artery disease. The symptoms of coronary artery disease can vary, but chest pain is the most common manifestation. Angina typically occurs during physical activity or emotional stress when the heart muscle requires more oxygen-rich blood. Other symptoms may include shortness of breath, fatigue, and indigestion. A rupture in plaque deposits within the arteries can result in a complete blockage of blood flow, precipitating a heart attack. An emergency that demands immediate medical attention, emphasizes Dr. Rozo. The consequences of untreated coronary artery disease. Left untreated, coronary artery disease can lead to additional complications, including arrhythmia and congestive heart failure. Arrhythmia, or irregular heart rhythms, can be life-threatening. Congestive heart failure occurs when prolonged reduced blood flow weakens the heart muscle, making it unable to pump blood effectively. Prolonged reduced blood flow to the heart muscle weakens its function, resulting in irregular heart rhythms and eventual heart failure, explains Dr. Rozo. Therefore, it is imperative to promptly address the condition to reduce the risk of these serious consequences. Can atherosclerosis be reversed? A common question arises: can atherosclerosis be reversed? According to Dr. Rozo, the reality is that plaque buildup cannot be fully reversed. This underscores the importance of preventing atherosclerosis in the first place. However, effective management of coronary artery disease can help prevent further plaque buildup and stabilize existing plaques. Lifestyle modifications for managing coronary artery disease. Comprehensive lifestyle modifications are crucial in managing coronary artery disease. The American Heart Association's Life's Essential 8 provides a helpful guide, emphasizing the following habits. 1. Healthy diet. Prioritize a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Reduce saturated fat intake and avoid diets high in saturated fats, such as the keto diet. Instead, aim to follow the Mediterranean diet, which is rich in healthy fats, complex carbohydrates, and fiber. 2. Regular physical activity. Engage in regular physical activity, aiming for at least 150 minutes of moderate intensity exercise per week. 3. Avoid smoking. If you smoke, quitting is one of the most important steps you can take to improve your heart health. 4. Weight management. Maintain a healthy weight to reduce the strain on your heart and lower the risk of coronary artery disease. 5. Manage blood pressure. Keep your blood pressure within a healthy range through diet, exercise, and medication if needed. 6. Control cholesterol levels. Work with your healthcare provider to manage your cholesterol levels through diet, exercise, and medication if necessary. 7. Blood sugar control. Keep your blood sugar levels in check, especially if you have diabetes. 8. Get enough sleep. Aim for 7 to 9 hours of quality sleep each night to support overall health. The role of medications in managing coronary artery disease. While lifestyle changes play a crucial role in preventing disease progression, medications become necessary when significant damage or plaque burden has already occurred. The severity of atherosclerosis and its impact on the individual determine whether medications are needed. We must consider each person individually when determining the best course of action, emphasizes Dr. Rozo. If plaque burden is substantial, stabilizing it becomes critical. By doing so, we can mitigate the risk of plaque rupture, which is the primary concern as it can lead to an acute heart attack. Statins, a type of cholesterol medication, serve as the cornerstone of treatment. They not only lower cholesterol levels but also stabilize plaque and reduce inflammation in the arteries. Statin therapy has additional benefits beyond cholesterol reduction, which include decreasing the risk of cardiovascular events, Dr. Rozo explains. Additionally, medications such as beta blockers may be recommended to alleviate stress on the heart muscle, while low-dose aspirin may be prescribed to prevent blood clot formation. A coronary artery calcium scan is an invaluable screening tool that aids in identifying individuals at a higher risk of a heart attack, even in the absence of symptoms, Dr. Rozo adds. During the scan, calcium deposits in the coronary arteries are detected, and based on the amount of calcification present, a score is assigned. The higher the score on the coronary artery calcium scan, the greater the buildup of plaque, indicating a heightened risk of plaque rupture and subsequent heart attack. If the coronary artery calcium scan reveals significant plaque burden, your doctor may recommend any of statins, beta blockers, or aspirin in addition to lifestyle changes. Coronary artery disease is a serious condition that requires proactive management. While atherosclerosis may not be fully reversible, adopting a heart-healthy lifestyle, making dietary changes, and adhering to prescribed medications can effectively manage the disease. By doing so, individuals can reduce the risk of further plaque deposition and promote overall heart health. Remember, early detection and intervention are key to preventing severe complications. If you have concerns about your heart health or have been diagnosed with coronary artery disease, consult with your healthcare provider to develop a personalized management plan. Thank you for joining us on Dr. Mai, sharing medical knowledge. Don't forget to subscribe to the channel, like, and comment below to support our channel's development and receive more great topics. Stay informed and take proactive steps to maintain your heart health.